Good evening, everyone. Everyone connecting to us from various parts of the world, from Nigeria, from Africa, and from other parts of the world. It's March series again from Faith Ministry, and this event is put together for our parenting support community. It is to aid parents to be, child caregivers, and everyone that has any business raising a child, to aid them, equip them, and get them more prepared to raise children. And it is to this end that we are having March series. So March series is we are having a series of events, we are having a series of discussion as concerning our children and how those issues affect us as parents. This event is powered by Faith Ministry, and by God's grace, briefly, I need to let you know that Faith Ministry is shouldered with is founded with the focus and shouldered with the responsibility of raising children for God. And the centerpiece of our assignment is raising godly seeds. And as such, everything we do, and as God helps us, we have that as our focus. This March series, we've had different speakers, sharing different issues with us. Last weekend, we hosted Dr. Olaseyinde and as well Dr. Emmanuel Ojedeji. And just yesterday, we had Mr. Abibola Fagbemi, who is a speech pathologist, taking us on a session on speech acquisition and delay in children and how it concerns us as parents. And this evening, we have the privilege and honor of hosting in this meeting tonight our guest who is going to be taking this powerful session on autism, parenting implications for raising an autistic child. Very briefly, I'm going to say a few things about her as we get prepared to have her speak to us. Our guest speaker tonight is a graduate of psychology from the University of Lagos. She holds a master's degree in clinical psychology from same institution. She has been certified to work in the field of autism from the International Board of Credentialing and Continuing Education Standards, IBCCES. Her career as a young, vibrant, and dedicated psychologist has lasted for about 7 years to date. And she has eventually earned her spot as a psychologist working with Patrick Speech and Languages Center, that's in Ikeja, Lagos. A job she does presently with passion and enthusiasm as she works with children with special needs. This has become a lifestyle. She currently resides in Lagos. She's happily married to Mr. Victor Ibimidu, who is also a guidance counselor with young adults. And their union is blessed with Isaac. I've been privileged to work with her, and I'm trusting that tonight we're going to learn as a community, gaining so much knowledge from our wealth of experience without taking further time, I'm going to be welcoming tonight Mrs. Tosin Ibimidu to take us on this topic, autism, raising implications, parenting implications for raising an autistic child. I need to enable from this end so that I should be able to share our screen with us. And while we wait to do that, I want to plead with everyone, please, if you are online with us, kindly invite your friends, your loved ones, for them to be part of this, because it's a time to learn and add value as parents and parents to be. Yes, ma'am. You're welcome. Thanks for joining us this evening. You can share your screen with us now, and you'll be able to talk to us.
Yeah, good evening. Can you hear me?
Yes, ma'am. We can.
Okay. Yeah, good evening. Good to see you. Now, I'll be talking on parenting implications for raising an autistic child. So I have few slides I'll be sharing, and I'm going to make it very simple for everyone to understand. Okay, sorry. Sorry, I'm trying to share my screen. Okay. Are we together? Please, I need the response. I want to know if you can hear me.
Yes, ma'am, we can.
Okay. All right, so I'm going to be talking about parenting implications for raising an autistic child. And my name is Tosin Ibimidu. Okay, like Mr. Samuel have earlier said, I'm a psychologist for both degrees, and I work in an autism center, and I'm a certified autism specialist. So we are going to be talking about parenting an autistic child. Autism spectrum disorder. So the shortened form for it is ASD. It's a complex pervasive developmental disorder, and is a lifelong developmental disability. That means that it's from childhood to death. Like, it affects the way a person communicates and relates with people around them from childhood to death. It's a lifelong. And children and adults with autism have difficulties with everyday social interactions. That's the ability to relate with others, the ability to relate with their siblings or their parents, or the ability to even show their expression. If they're angry, the best way to communicate their anger, or the best way to make people know what they want at any particular time. They have that challenges. And ASD causes disruption in the normal process of brain development and functionality. And this alteration results in three major areas of child impairment. We have three major impairments in autism. And these three major impairments is categorized in three ways. It's in the way of their lack of communication, in social interaction, and in their behavior. So when you see a child living with autism, whatever that is wrong with them is categorized in three major areas. And these are the three major impairments under autism. So my next slide is going to be showing these three major impairments, which are language and communication as the first one, behavior as the second one, and social interaction / play as the third one. So, and these three impairments is the major thing that you could describe an autistic person with. Reality to an autistic person is confusion. And what I mean by this is that they want to do their things in the same way and the same manner. They don't want a change. So when you want them to do a new thing, they immediately become so confused. They want to do their things the same way, the same routine. They don't want their routine to be changed. And so a lot of time, if anyone look at someone that is living with autism, they'll be like, oh, this child is stubborn, this child is naughty, this child is stubborn, this child is naughty, and the parent did not train the child well. So it's not always like that. And another thing is that because an autistic child does not have a physical disability, is most time as a result of confusion to every other person looking at them on the outside. Like, no, you can't tell me that this child is autistic, but he's walking now, but he's talking now, but he's not shaking, he doesn't have any coordination problem. So they don't have any physical disability, and people are so confused as them believing that they have autism. So most of the time, people terms it to be like, this child is naughty. I'm sure the parent did not train him or her very well. I'm sure they are not controlling him or her in the environment. So it's a confusing stage. And according to National Institution of Mental Health, some possible early indicators of autism includes the following. Includes that they does not babble or point or meaningful gesture at 1 year of age. About 12 months, and the child does not even point. 12 months is not pointing. Imagine at 12 months, the child is not pointing. Like normally a child will point like this, or there's a particular toy that you take all over the child's eyes and it's not looking 360-degree looks on it. The child is supposed to point at 1 year, and the child is not pointing, and it's not even making any sound. Those are the signs of autism. The child does not speak one word at 16 months. 16 months is about a year and 4 months, and the child is not even making any words. Does not combine 2 words by 2 years. Does not respond to his or her name. Then you call the child, you kept calling, and he's not responding. Then sometimes the child loses language or social skill previously acquired, and some of them actually, they might have gained some words all along. Maybe they'll be calling daddy, mommy, or wee or water and the likes. And at some point, all of the words were lost. They can lose those words. And another thing is that they can avoid seems to know how to play with toys. They can hold the toy and avoid seems to know how to play with it excessively. And sometimes some of them, a whole lot of them actually, They will line up their toy in a line, in a straight line. And anyone that just disrupts the lines, they can fight the person, they can throw tantrum and destroy things. They put their things and in a straight line. Those are the repetitive behavior that happens, that is very, very common with an autistic child. Then they are so attached to a particular toy or object. When they are playing with a toy car, it's a toy car at a time, no sharing, no living, and they're just holding on to it and that one alone. They sometimes join in a play, but then it has to come with the effort of the adult, of an adult, bring their hand to join in a play. And some of them too, I'm going to be moving to classification of autism as time permits me. So that's one. Some of them under Asperger, they talk incessantly. Incessantly means that they talk a lot, a whole lot. Kept talking, keep talking, keep talking, keep talking. They say a whole lot of things. But the thing is that even when they pick a topic to talk about, mommy, I want food, they will not complete the sentence of that topic, then they drop it, pick another topic, they will not complete the sentence of that topic too, and they drop it. And some of them too, inappropriate laughing and giggling. Some can do some things very well, very quickly, but no task involving understanding. They do things. You want them to do a particular task, to carry out a particular task, and they are very effective at what they are doing. But then they don't understand what they do at that particular time. We're still talking about the science of autism, and that's what autism is all about. Then I'm going to be talking about what do we consider for autism not to be. I want to talk about what autism is not. Autism is not a rare disorder, like it's very common. Autism is not a mental illness, and those affected are not imbeciles. Most of the time, when you tell someone that, oh, this person has autism, say no, it's not drooling. What I mean by drooling is a child that brings out spit. No, it's not drooling. If you said that, no, that child is autism, no, but it can work very well. See, autism does not come with a physical disability. Autism does not come with a physical disability. Is way different from Down syndrome. Is different from cerebral palsy. Is different. It's different. It does not have a physical disability. Autism is not only for the rich. Neither is it the white man's problem. Most of the time, we find out that people like, oh, I saw Olowoni and that and that and that. No, it's not that. It's not just for the rich. Autism is everywhere. Is everywhere. But due to lack of awareness in Nigeria, there's no specific data that has revealed the prevalence of autism in Nigeria. We don't have a statistical data in Nigeria about autism, but we know that autism is 5 times more common than Down syndrome. Down syndrome is the extra chromosome. And also, autism is also 3 times more common than juvenile diabetes. Yes, autism is common, but we have issue with the awareness. There's not been detail about the awareness. So a lot of people seems not to know about autism, but then that does not mean that there's no autism. Autism is common. So when you get to school that's like, oh, this is autistic school, you feel like, oh, we have a whole number of these children in this school. Where did they come from? Is it in this Lagos? It's everywhere. It's everywhere. So it's just the awareness that we need all over, so that people will know about autism, and so that people that have to be keeping their children at home, they would not do that anymore, because early intervention is the key. We need them to bring them out so that they can see the right intervention for proper monitoring, and that will give them improvements as they grow. So diagnosis of autism. Diagnosis is based on observed behavior. It's not like, when when someone has malaria, you have symptoms and like, oh, I have headache, I feel tired. And then when you go to the hospital, the doctor will be like, how do you feel? Doctor will ask you, how do you feel? oh, I feel tired. Okay. And then whatever you say to the doctor, then he will know the kind of text that he prescribed, the kind of text that we will conduct on the person, a laboratory test. But when it comes to autism, there's no lab test, there's no laboratory test, there's no any form of testing. How we come about our diagnosis is from observation. And though we also do tests, we undergo some testing, but our own form of test is we use DSM-4. It's a manual. It's a manual form of testing that we do. So the doctor will ask, it will still be a children pediatrician that will still ask, we still have the parents some form of questions on what is happening to the child to bring up a diagnosis. And it's not everyone that does the diagnosis. Even if it's a center that is an autistic center, they might not be doing the diagnosis, but they will refer the parents to where diagnosis can be done. Yes, and diagnosis is done through observed behavior and testing. And the testing here that I mean is not a lab test. It's not by collecting the blood or the urine. No, it's by observation, and we have a particular manual for our testing. Diagnosing autism spectrum disorder can be difficult because there's no medical test, like I said, like a blood test to diagnose disorder. Doctors look at the child developmental history and behavior to make a diagnosis. Yes, that's what we do, just like I've said. No laboratory test. Now, causes of autism. Autism can be said to be idiopathic. That is, it has no specific cause. Autism doesn't have a cause, and that's why it doesn't have a cure too, because it doesn't have a cause. But then there are some in research I've been like, oh, okay, autism doesn't have a cause, but then in a way we can relate it to this or that. There's still no cause, but ongoing research focuses studies on genetics or a child being born to older parents. Genetics in the sense that they feel like if a particular parent has a child that has autism, it's most likely that the one that follows too might have autism. But in some ways too, it's not, we have seen that it's not the immediate generation that has the autism. It might be like a past generation that has the autism. It might be a past generation or an immediate one. But studies have shown that it is traceable to gene. Though we can't pinpoint that as the cause for autism, because there are other ways too that they have been looking at, like being born to older parents. Another research shows that if older parents can give birth to an autistic child, or low birth weight, maybe a child is supposed to weigh 2.5 at birth. I think that's the minimum age. I'm not so certain about that, but then maybe a child is now weighing maybe 1.7 or so, that could be a cause of autism too. Then diet, then vaccine. So people link it to especially this 9-month vaccine, that's measles vaccine, especially that, because I get to hear that in my field of study. I get to hear that a lot when I'm speaking with parents, and the mother, and there was a particular mother, she was like, yes, I know, it was that particular 9-month vaccine, that particular measles vaccine, it was the one that brought out autism from my girl. And the woman was like, no, she didn't have it before. She was talking, she talked when she was supposed to talk. She sat when she was supposed to sit. All her developmental milestones were age appropriate. It was that particular 9-month vaccine that brought out the autism. And then that day, I asked her that, Boma, is there no traces of autism in your gene? Maybe from the dad's family. So like, oh, yes. That later she find out that the daddy, Edes sister. So now for her, that's two things. It could be traceable to her gene, and she also thinks it could be vaccine. So but even in all of these things, we could not pinpoint what particular thing causes autism. Then sometimes they said head trauma, maybe when I was pregnant. Some people say when I was pregnant, I fell down, I hit my tummy on the floor, and that could be. Then sometimes it could be medication. This one, sometimes it could be medication. During pregnancy, you got a drug that is antidepressant, acetaminophen, or a class of asthma drugs. All of these things are still, they are not the major thing that causes autism, but there are things that are being traceable. Autism is being traces around these things that we have mentioned. But the researcher could not really say this is a particular thing that causes autism. Like how we can say that in Nigeria, mosquito causes malaria. So that means that even in all of these things that cause malaria, we know that mosquitoes causes malaria. But then for autism, they could not lay their hand on a particular thing that causes autism. And so as at present, there's no definite answer with regard to causes of autism. So for the treatments or cure, at this moment, there's no cure for autism. Obviously, because I've earlier said that there was no cause. So obviously there can be cure. It's only when you know that mosquito causes malaria. That's when you can look for any malaria drug like Amala, Amatem, and all that, because we already know the cause, and then we can know the cure. But now, since there's no definite cause, there's no cure too. But however, knowledge of autism improves and services continue to develop. All along, the researchers are still trying to find out their way in which we can improve or develop our knowledge of autism, so that we can streamline the course to one thing, so that we can actually get a cure for it. Individual with ASD has more opportunity than ever of reaching their potential. Yes, they do. They do, really, they do. And that can only happen. They can only reach their potential, full potential. That can only happen if they seek early intervention. And we are going to get to that much later. There are many social and educational interventions that can greatly enhance our individual's life. No particular treatment fits all, but can be managed through special education, behavior, medical management. So a lot of time, because if an assessment has to be carried out on a child, and then if an assessment has to be carried out on a child, an IEP will be drawn, and then the child can be placed on accurate plan for the child to have improvement in whatever area that the child needs for development. And most of the time where I work, we don't actually encourage parents for medicals, especially those ones that have destructive behavior. The parents might want to like, okay, the child have destructive behavior, it destroys things, especially in the night, it just screams and screams and it doesn't sleep. And then when I went to the hospital, I was advised to use a particular drugs. And when I started using it, the child sleeps. But we discovered that after some time, there's an effect of the drug on the child. Is that the child is very hyper afterwards when he stops the drugs, or the child becomes very dense, that is not even the the brain is not even alert anymore. So in my own center, we don't advise medications, but then some parents, some doctors, even doctor pediatricians, go with medications. Symptoms and behavior of autism can also combine in many ways and vary in variety. Yeah. But in general, children with ASD respond best thoroughly through structure and specialized therapy. Yes, they respond best through structure and specialized therapy. Each child work with each method. There's no method that work for all. They are different on the spectrum, and so it's different method that works for them. They are unique in their way, different on the spectrum, and it's different method that works for them. Early intervention avoid most individuals the best option for recovery and others. The best opportunity to live a functional life. early intervention can start as early as 18 months. Yes, as early as a year, 6 months, as early as a year, 6 months. And this is where parents, especially mothers, have to be very observant. This is where, especially if most of the time when we have issues to be like, okay, oh, it's my first child and I don't know when it's supposed to sit. I don't know when it's supposed to say the first word. I don't know when it's supposed to start crawling. So in a way, we tend to understand with the parent that probably is their first child. Okay, they don't know. But on the contrary, sometimes you might have a parent that like, oh, it's my fault. And then you did not still do anything to the child is like 10 years. Oh, mom, what were you looking? What were you looking at? And so they might be like, oh, I've been busy. I have to drop email in the morning. I have to go to work. And then when I go back, it's already sleeping and that and that and that. Parents have to be very observant. They have to know. So even when you are a busy parent, even when you have to go out very early, you have to come back late, please ask questions. Ask questions from your maid, how the child is faring. Ask questions, and all the time that you're around, the weekend that you're around, ask questions like, how is Tito? Is he doing well? Ask questions from the school too. This will make you to get to know if the developmental milestones are age appropriate. Then we also need to read to know. And if you're a first-time parent, a first-time mom, please read to know when the child is supposed to sit, when the child is supposed to crawl, child is supposed to stand, child is supposed to make a first move, first step, child is supposed to say a first word. And this, because even if a child have autism and you eventually go for an assessment, these are the questions the mother or the father will need to fill inside the form. You need to fill the developmental milestone at the exact age your child does that, at the exact age your child crawls or walks or talks or even feed self or even use the toilet. So parents, please take note of that, because it is when you know all of these things, that's when you can seek intervention. And when a parent is getting to know as early as 18 months, oh wow, the child is going to get his or her full potential very quickly and join his or her colleague or peers in the mainstream school and will do so well. So moving forward, autism is currently fastest growing global disorder, growing at an annual rate. Is so growing, is growing. But then autism affects more boys than girls on a ratio of 4:1. We don't have a specific statistic in Nigeria, but then you can see the UK statistic, the US, the South Africa, the Korea. But globally, autism affects 1 in 67. That means that as many as we can be, if 67 child is being given birth to today, be sure that an autistic child will be among them. Autism affects 1 in 67 and is more for boys than girls. Now, I'm going to be going through to 5 major components of autism spectrum disorder. We have 5 major components of autism spectrum disorder. I'll run through them. We have the first one is autism. We have autism. We have Asperger syndrome. We have pervasive disorder. We have pervasive developmental disorder, not otherwise specified. We have the Rett syndrome, and we have the childhood disintegrative disorder. So this autism, sometimes we classify this autism. We have 5 major components of autism spectrum disorder. Autism spectrum disorder, that's ASD. Major components of ASD. And so the first one under the component of ASD is A, which is autism. And this so many of the time we classify it as classical autism because of their characteristics. But most of the needs of this group and intervention techniques have not proven effective as similar to those used for children and adults classified with autism diagnosis. This This is autism itself, and is the one that is widely used when you want to like, oh, I have an autistic child. It is very rare before you hear a parent say that I have an Asperger child, or I have a Rett child, or I have childhood dysgraphia, or I have PDD-NOS child. What they say mostly is I have an autistic child, because it is widely diagnosed within the spectrum, and there are several other specific diagnostic classification as well. So I will just say briefly about this. Then later I will say the similarities in between them. Then the second one is pervasive developmental disorder, not otherwise specified. That is PDD-NOS, sometimes referred to as atypical. The first one is classical autism. And so this one is atypical autism, referred to those people on the autism spectrum who share many of the characteristics but don't meet the criteria for classical autism. These people might not show the precise number of characteristics, but people just believe that the summary of it all is that parents or researcher believes that any child that is on the spectrum, that has this PDD-NOS on the spectrum, is a milder form of autism. Like probably autism can be, what they're trying to say, that autism can be severe, and then this is a milder form of autism. Even when it has same characteristics with autism, like okay, it's still a milder form of autism. It's still fairer. And then we have Asperger. This Asperger is similar to autism though, but the social and restricted interest characteristics are identical with autism. The difference is in the area of communication. A person does not have to demonstrate any communication difficulties to qualify as Asperger diagnosis. In fact, it is a requirement that their language development at the normal time, usually using words by the age of 2 and simple phrases by age 3. The difference between them is that an autistic child might be a non-verbal child. He doesn't have any words. He has not said anything. But Asperger has plenty words. Even by 2 years, the child is talking. By 3 years, already making sentences, simple phrases. Excuse me. And for diagnosis of autism, it is also required that person had an average IQ. But a dual diagnosis of autism and Asperger is impossible under the present system. If a person qualifies for the diagnosis of autism, then the additional diagnosis of AS is not permitted. Okay, because it depends on, okay, when a child is being diagnosed of autism, that means that there might be a trace that the child is non-verbal. So there's no need doing an Asperger syndrome diagnosis. But if a child is being diagnosed of autism, if a child adds speech and is already combining 2-3 phrases, it might likely mean that it's an Asperger and not an autistic child. So that's this. They have high functioning, and they have self-awareness than the children living on the autism spectrum. But then, even in all of these things, they still lack social interaction. They have social deficits. Okay, and so the fourth one that I'm going to be talking about is Rett syndrome. Rett disorder. But this Rett disorder is called girls' autism. It's majorly found in girls. Usually appear after a period. But what happens to this Rett disorder is that the child has a full development till 6 months. That means that whatever developmental milestone that the child needs to have between 0 to 6 is very accurate. And then, and sometimes it can even be longer. But then the child now will start losing all of this again. But basically, it's just girls that it happens to. They have loss of interest and skills in social interaction. They have lost a lot of speech. That means that even if they had speech as early as whatever age, it will be lost again. And the most severe thing about this Rett disorder is that they have motor impairment. They have loss of impairment in the use of their hand. So that's why they start purposeful and manipulations are replaced by repetitive moving. Before, they will have been using their hand meaningfully. Maybe the child will have crawled, and then this time around it's just wiggling or clapping or just rubbing in between thighs, rubbing it on anywhere, or just biting, just wiggling. No definite thing, not effective thing, not effective way of using the hands anymore. Girls with Rett syndrome usually have severe learning disabilities. They have very severe learning disabilities. They have regression. So whatever they might have learned while they are growing, whatever they might have been able to say while they are growing, they lost all again. And this just happened to girls. So that means that they have accurate growth from 0 to 6 months. And then it comes down. A regression happen. Then the last one in these 5 major components is the childhood disintegrative disorder. This is similar to Rett because it involves a period of normal development. Yes, but then the difference between this and the other one is that Rett is just 6 months, while this is 2 years. Rett has a normal development till 6 months, and then there's a regression. But for childhood disintegrative disorder, had a development to 2 years. Wow. A good rapid development to 2 years of age before a decline happens. And this decline followed by loss of skill, resulting in severe cognitive, social, and motor impairments. The motor is the movement of hands, movement of legs. There's a reduction, there's a regression, it comes down. But this also, as Rett happened to girls alone, this happened to both gender, both male and female. That's what this happened to. And with that, we have come to the end of the 5 major components of autism. Autism in itself, we have PDD-NOS, pervasive developmental disorder, not otherwise specified. We have the Asperger syndrome, we have the Rett disorder, and the cognitive childhood, and the childhood disintegrative disorder. Those are the 5 components of autism. So I'm going to be going to my topic of today, which is parenting an autistic child. Now, I just gave a broad knowledge, or a simple but kind of broad knowledge of what autism is, what autism is not, and the characteristics of an autistic child, and different form of autism, majorly the 5 components. And so I'm going to be going to parenting an autistic child now. Parenting a child with an autism spectrum disorder involves several processes and emotions during this transition. Yes, when a mother is pregnant and like, oh, I'm just trying to place this on my head. The mother is pregnant, came home to meet the father, like, oh, my husband, I'm pregnant and all that. And then we've been thinking of, oh, if this child comes, I'm going to name the child this particular thing. You have good dreams on your head, how you want your child to be, the school you want your child to go to, how you want your child to function, and the likes. And then the child comes out, and fortunately, the child had normal developmental milestone, and at some point, maybe 18 months, 3 years, you were discovering that the child is not pointing or isolated, doing lining up objects in a repetitive manner. And then when you went to the hospital, you were told that the child is autistic, and then all of your dreams and aspiration was dashed in your front. So it's a period of emotions. It's a transitional period that the parents themselves have to admit that, yes, this is it. We have to face it, because it is when they accept, it is when there's an acceptance, that's when there can be a progress. If the parents did not accept that, they won't be moving forward. So that's why it's a process. of emotions. Is a process of emotion. And in addition to the family natural transition, when a child is born, the family of a child has to deal with the peculiarities of disability, especially when the child is not the first one. And the parent is like, wow, because all of the milestones that the child is going through is wowing you. You know that you have the first is sitting, the first does this by himself, he did this, he did that, and then the second is not doing, he's just sitting like that. You called, you just move towards you, not making, maybe it might even be a child that is not verbal, or is not, or a child that has a lot of behavioral issues, moving from one place to the other, is a lot of emotional stage. Parenting a child with autism spectrum disorder can be stressful and challenging, particularly in this country of ours, where support systems are very minimal, they are very limited, or even stigmatization. So you don't even when you get to know, and you were told in the hospital, and you have a series of time to cry, and then you had the issue of bringing the child out, or you eventually take the child to a mainstream school, and the school will be like, madam, you cannot stay in this place, it's too wicked, they don't understand the kind of peculiarity is carrying. So it's a time of emotions. Meeting the demand of this individual require much time, effort, and patience. Patience on the part of the parents, patience on the part of the teachers too, if you're a caregiver, patience on your part, patience on the part of a neighbor. If you're a neighbor to a parent that has a child living with autism, patience on your part. If you're a church member of a parent that have a child living with autism, patience on your part. If you are a Sunday school teacher of a parent that has a child living with autism, patience on your part. Patience, because it's supposed to be a work together, have to work together. So if parents did not have a support system, it results in depression, this results in distress, it results in mental or physical health problem for them. However, intervention for children with ASD often require parents' involvement and also aim to increase parent caregiving skill, self-efficacy, knowledge of the disorder, and aim to reduce family stress. Yes, if the parents if they can accept it by themselves, they will take a bull by the horn and they were able to stand up for their child. Every other person would support them, but then they have to support themselves first. They have to be an advocate for their own child. So even if their child is voiceless, they have to be the voice of the voiceless. Parents of children with ASD reported elevated psychological distress. Yeah, especially mothers. They are distressed, they have family issues. That's why even in school with autism that I work, you see mothers. And then anytime we have to see a father that working with a child, we will celebrate the man. Hey, thank you, daddy. Thank you for staying back by this boy and all that. Because we get to see mothers, and you hear their story like, oh, we are divorced, oh, we are separated, oh, this, oh, that. So parents, especially mothers of these children, go through distress. They have psychological problems, their mental health have to be in place. And a lot of them, they have family issues. They don't have life of their own. Some of them are pulled out of their jobs because they want to be there for their children. So caring for this child with autism increase stigmatization of both parents. Like I've said this, so all of these things are what these parents go through. But as a community, we have to help one another. We have to be your brother's keeper. Be an advocate for a child living with autism. The fact that you are a parent that is no longer giving birth, we have your number of children, praise God. But then be an advocate for the voiceless. Be a voice for the voiceless. Be there for anyone that you know in your community that has a child living with autism. It can be very draining. it can be very draining. But then a little word, you don't need to give them money. You might not necessarily need to give them money at all time, but then the words of your mouth should not hurt. So we have to be our brother's keeper. Yeah, and this is going for the parents now. If you're a parent, if you're a mother or a father or a caregiver that have a child living with autism, don't wait for official diagnosis. That means that you have to have noticed some signs at the development of the child. Excuse me. Seek help as soon as you suspect something is wrong. As soon as you suspect that. So that means that you have to read. Google about it. You have to read. When is this child supposed to sit? When is the normal stage for a child to walk? When will it be getting too late if this child is not walking? You have to read far and near so that you know when to seek help. And the help that you seek early intervention is the key. The help that you seek early make a whole lot of sense, and it makes the child to come to full potential of him or herself. Learn about autism, educate yourself, educate others around you. Become an expert on your own child. Figure out what triggers your child challenging behavior. Know that whenever any form of behavior that we exhibit, even as a typical person, any form of behavior that we exhibit is a way of communication. A typical child, any form of behavior that a typical child, not even a child living with autism this time, any form of behavior that anyone exhibits is a way of communication. So now that you're having a child living with autism and is exhibiting a particular behavior, please be calm enough to know the trigger. There will have been something that triggered that behavior. There will have been a trigger. There's something, a trigger means there will be like an antecedent. Antecedent means that there is something that's happened before the behavior occurred. And immediately after the behavior, what did you do? And then what you did after that behavior, was it reducing the behavior or making it increase? So the antecedent is what you do before the behavior is ABC. ABC techniques in behavior. A is for the antecedent, then the B for the behavior itself, and C for your reaction. So whatever you do, the way you react after which the behavior has been carried out, what implication does it have on that behavior? Is it increasing it or reducing it? So parents should be calm enough to know the trigger of a child's behavior. If you do know, anytime the child is about to exhibit that behavior, you will provide whatever the child needs or whatever the child needs to say, and then there will be a reduction if the behavior is the one that is not appropriate. Accept your child quirks and all. Accept your child's peculiarity. Accept that your child is special and should be treated as one. But then that does not mean that the child is supposed to wash plates. I'm like, oh, this child is autistic. Oh, don't let him wash plates. Oh, this child is autistic. Oh, I don't want him to sweep. Oh, this child is no. It should still go through the normal routine, normal details, normal duties that the other siblings are doing. It should be treated like every other typical child. But then in a way that you might just be calmer. You might be calmer for the child, because his own learning skill might be a bit low than the peers. Accept it, rather than focusing on how your autistic child is different from other children or what he or she is missing. Practice acceptance. The parents themselves have to accept. This is when you accept your own child. That's when every other person around you will accept the child too. Don't give up. That's not the solution. Don't give up. Don't give up. It's impossible to predict the cause of autism spectrum disorder. And don't jump to conclusion about life. Like, oh, they just gave me a diagnosis that my child is autistic, and then that's the end of life. If the intervention comes so early, don't give up. You should know that, yes, for a child that you just discovered that has autism, is basically going to have a full potential after some time and go back to mainstream school with the peers, and then the child will function so well as though the child never had autism if he had the right intervention at any stage. And for those ones that have it at adolescent or at teenage age, if they also had the right intervention too, they would be taught how to function well in the society by doing their basic functional life skill activities like washing of plates, like laying of bed, making use of the washing machine, like polishing of their shoes, like packaging, folding of shirts, laying their bed, because mom and dad would not always be there, and then they have to be there for themselves and have a functional activities that they can undergo by themselves without maximum supervision from an adult. And for a parent of children living with autism or a caregiver, consistency is also the key. Consistency, parent involvement, these are the keys. If a child, even if there's an early intervention about your child and the child is being taken to a center that is being monitored for the whatever the child is supposed to do, if there's no continuity in the home environment, the progress will be slow. The progress will be slow. So consistency, continuity is the key. So that you will be on the same page with the therapist that is working with your child and the home front. And so, like where I work, we always tell parents that if you're seeing something we are not seeing, that's why we need you to communicate with us. In case you are seeing your child is doing something else at home and also doing something else in school, but if you are not telling us anything, we won't know. But we need you to communicate with us. That's where we need consistency and continuity. We don't just want our therapy to just finish in the center alone. We want the home environment to also continue. Stick to a schedule. Yes. And a child living with autism does not want to change your routine. Yeah. They will throw tantrum. Yes. So if you're changing their routine, they need to be notified. Like tomorrow, we are going to the mall tomorrow. Tomorrow we are going to the mall. And you're like, oh, Toby, tomorrow we are going to the mall. We are going with daddy and mommy. We'll go in the morning and we won't stay too long in the mall. You are telling him that in the morning and you're showing the picture of a mall. Then later in the afternoon, yes, tomorrow we are going to the mall with daddy and mommy and we won't be staying too long at the mall. You tell him consistently. They like a schedule. So if you are going to alter their schedule, be prepared for war, and their own way of engaging in a war is tantruming. Yes, you prepare for a war. So they need to be notified of any schedule that is going to be changed. So at any point, a good behavior should be reinforced. That means that parents have to be calm enough to discover that it's not just complain, even for a typical child, even for an adult, even for mommy and daddy. It's not just complain all the way. There should be time that a good behavior will be reinforced so that the good behavior, the positive behavior can continue, so that the negative behavior can be discontinued. So if there's a reinforcement for a good behavior, it will make the behavior to continue. Create a home safety zone. Carve out a private space in your home where your child can relax. The home first should be a relaxation center, but then there should not be a queen and a queen in their house. Like I get to know that in the center, or I guess that happens to all of the children. Even a typical child, they are so scared of their teacher. Hey, I will call auntie Kiniko, I will call uncle, and then they are back on their feet and they are so calm. But when they are at home with daddy will talk to them like, you know. But so they should not allow them to be the queen and the king in their house at all time. But that does not mean they won't have their own time too. But you should allow them do the activities you want them to do, but there should still be a playtime. Find non-verbal way to communicate. The fact that the child is non-verbal, does not have speech, does not mean that the child does not have a good receptive. They still hear. So keep talking to the child with gesture, with body movements, and sometimes use small sign language. Sign language, this is it, this is drink. There are normal sign language that anybody can know. This is it, this is drink, this is, this is me or my or something. Small sign language that they can know. Should use alternative form of communication. Like I've talked about this earlier. Find out why the child is throwing tantrum. What's the cause of the behavior? What triggered that particular behavior? Find out that. Make time for fun. It's not just you want the child to sit quietly, or because he wasn't having a good sitting span, and you want the child to just sit calmly in one position and not standing up. There should be time that allow her to just have a time. Just make sure that the environment is safe for the child to have a moment. Pay attention to your child's sensory sensitivity. There are a lot of children that have sensory overload. There are a lot of children that have sensory overload. Like a child, like an example I made the other time, the child wants to go to the mall, and even while you are saying it, especially for a child that has sensory overload, auditory, all his hands are always covering the ears like this, But then if you have prepared the child that we are going to the mall, you still have to look at the time in the mall that people will be minimal, that you can be able to go, that it won't be so much noise. So because a lot of our children have sensory overload, it may be to smell, even to perf. Some children react to perf, to smell, to food, to lights, to lightning, to noise and the likes. Find that the one that your child has and find a way around it to curb it. Join a support group, it gives strength. A problem share, even if it's not fully solved, will be half solved. Speak out, please, speak out. We know that people go through a lot, so you might need a therapist for yourself too, not just for your child this time around. Even as a parent, you might need a counselor. Please find one that you're very comfortable with and speak with the person. Yes, so I'm going to Psalm 139, 30-16 says, "For you created my innermost being. You knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. Your works are wonderful. I know that full well." So even if you have an autistic child, the child is fearfully and wonderfully made. The Lord, when God was creating the heaven and the earth, he said, and he looked and it was like, all that I've created is good. So all that God created, all of the creation of his hand, they are good. So even if you have an autistic child, they are good creature of God. The Bible says all things work together for good to them that love God, to them who are called according to his purpose. Autism does not have a cause, it doesn't have a cure, and there are no specific people in particular that autism has to come to. But if a parent is having an autistic child, God knows that the parent has the ability to take care of the child for his glory to manifest. Parents must brace up to the challenge and turn all negatives to positives. Divine healing is possible by faith, mountain can be moved. Parents must daily seek the face of the Lord. Pray to him. Commit your ways to his hands, the life and time of everyone with him. God bless you. Thank you. And that's the end of my slide and my talk this night. So I'm making room for question if there's anyone.
Thank you so much, ma. We are very, very grateful. Wow, a lot has been said. It's good to learn and gain knowledge. Before I will say so much, I think it would be good to ask for those who have questions. So if there's anyone who has a question, already I've got one. I have one here with me already. So if there are persons in the Zoom room who has a question or the other, you can either use the chat room or raise your hand so that we would ask you to ask your question. So if there's anyone like that, please, you can raise your hand and then we ask you to ask your question or post your question in the chat room so that our guest speaker can respond to it. While we wait to take questions, I want to say this. Autism is not a death sentence.
Yeah.
It's not a death sentence.
Yes.
But the key thing, the message is early intervention is key. It's very important. And how do we intervene? So to all parents and parents to be, when our guest speaker was showing us statistics, but we don't have that of Nigeria. Well, I don't know if you are, but I don't think it will be less than 1 in 50. So there's a lot that we can do as parents, and schools will not do it for us. Centers will not do it for us. I dare say that even religious organizations will not do it for us. Yes, they can play their part, but largely the assignment is in our hands. All right, let's take questions. I can't see any in the chat room. I can't see any question in the chat room presently, and no one is flagging hand. Ma, let me read the question that has been sent to me. The question is this: Is there a Yoruba name for autism?
Okay. I remember I was just smiling because we went to do a radio advert sometimes 2 years ago, and it was a Yoruba radio station, Radio Lagos. When we got there, we're trying to tell the man that we have a program that is coming on and for children living with autism. So we're struggling with the Yoruba name for autism, but the man said something, and so that's what I was saying. Said Ailerara Ipenijara. That's what the man said.
Wow.
So he said Ipenijara.
Okay.
But since I don't know either to agree to that, because autism does not have physical disability, so I don't know how that is Ipenijara anyways, but then I don't have an alternative.
Ipenijara, Ailerara. That's an effort, but I don't think it's exact yet.
I don't think so too.
Okay, there is a question here from the YouTube channel. Fantastic. Please clarify. You said there are no curse for autism. I can see curse there. I don't know if the person meant cure or if it is curse. Maybe you can take the two and respond to both.
I didn't get that question.
Let me read it again. What the person posted is this. Fantastic. Please clarify. You said there are no curse, CURSE, for autism. That's what that's the post. But I'm also thinking probably the person meant cure. So maybe you address both ends, ma.
You too. Okay. Yeah. I said that there's no cause of autism. Nothing is no specific, though there are things that around it. Like I talk about the gene, I talk about the genetics, I talk about medications taken in pregnancy, the class of asthma drugs, the antidepressants. Then I talk about edge trauma and the likes. And because there's no cause of autism, there's nothing causing autism. That is why there are no cure for it. It can only be managed all through life. That's why the definition of autism is a lifelong developmental disorder. So that's it.
All right, ma'am. The person who shared the first question,
Okay.
if there is a Yoruba name for autism, made this post to me. I observed labels such as imbecile in Yoruba used to tag these children. So how do we communicate to parents who aren't aware of this disorder in their local parlance?
Okay. Most of the time, even myself, like if I want to tell anyone that I work with children living with autism, and if it's an elderly person, I won't be able to communicate very well to the person, like, hey, because I won't have the word for the autism. They classify all of them to be cerebral palsy. Like people, cerebral palsy, they don't have coordination, they drew. And I'll be like, an autistic child looks just like you. It is only when the child display, that's when you know that something is actually wrong somewhere. There's no physical disability. They look so like us. It's only when they have to talk, maybe they don't have speech, or they say too much, like those ones that talk incessantly, or they have to cry at interval at the same time they were laughing. So that's when you could trace it. It is when they just display. That's how you know that something is wrong. But there's no physical disability. So I don't still know how to place that in Yoruba name. So they still said Ikpeni Jara. So I go with that since I don't have another.
Okay. Well, why we use that? There has to be more explanations on the science.
Okay.
So that we can communicate proper understanding to such persons.
Because for Down syndrome has this unblocked face, so extra chromosome. So everybody knows that. Yes, they have ASLU. For those ones that have for cerebral palsy too, it's shown too. So that have this big head hydrocephalus too, it's shown. Those are physical disabilities that can be shown, that can be seen. But for autism, no physical disability.
All right. For now, I do not think there are any questions, any other questions. There is none in the chat room, and then no one is flagging and on the on Zoom. The question from the YouTube has been taken, so I guess you are good to go for tonight. Lastly, ma'am.
Okay.
Yes, you have said things on having an autistic child. So, what will be your parting words to parents who are in those shoes, and to parents to be someone who has not had a child yet? We
So someone does not have a child that is going to
Don't
have
know. Of
autism
course, we
or
don't
what?
pray. I wouldn't say
Yes, yes.
so, but I'm saying generally now for people who don't have children yet. So, what would be your parting words for both sides?
Yeah, for someone that, for parents that has a child living with autism, my parting word for them is that we know, or like I said, I know that it's not easy. It's not an easy task, because I've also been on this field for a very long time. And even at that, it's different from a therapist. It's actually different from the parent that live with them at home, that see them 24/7. God is your strength, and you know that you're not alone. And for parents to be, I want to say that we want everyone to join in this one voice of advocacy. Be a voice for the voiceless. We want everyone to come out, and anytime you are seeing a post about autism, please try and share, because you don't know what's going to come to you tomorrow. It's not it's not designed for a particular set of people, and it doesn't have a cause that you will have prevented it. And because it doesn't have a cause, it doesn't have a cure. So anyway, you see anything, any post or any flyer about autism, please try and borrow us your voice to join in that, so that everyone too will know about it. There are a lot of parents that are hiding their children at home. We just finished an outreach recently, about 2 weeks ago. Discovered that a grown-up boy of about 22 years has been eating at home as long as he has ever been. And father was like, no, and all that. So they will have been, so he actually came because he thought he wants to come and share money, you know. That's why he brought out the boy. So there will have been some parents who, you might see, there might be anyone in our neighborhood, but being an encourager to everyone around, you never can tell how much the person needs those words at that particular time.
All right, ma'am. Thank you so much, ma'am. I'm sorry to add this. Someone posted it in our WhatsApp parental support community, and that will be the last we'll take before we call it a night. Is it generally accepted that autism is caused by abnormalities in brain structures? How true is this?
Abnormality in brain structure, yeah, it's brain now. So that means something is not working well in the brain. But then there's no pinpoint cause of autism. So that's it.
Thanks so much, ma.
Thank you too.
We are very, very, very grateful on behalf of our parental support community, every one of us at Faith Ministry, and all the children of the world. They're saying a big thank you for joining us tonight. And we pray that the Lord bless you and bless your home.
Amen.
In Jesus' name. Thank you so much, man. We are grateful.
Thank you.
For tonight, we are coming to the end of our program for tonight, and the series is going to continue next week. We're going to be having a session that I'm going to be privileged to lead, and then we're going to be having a session that is going to be led by Mr. Ebenezer. I know they're going to be very interesting sessions, and we encourage everyone to be part. Please invite your loved ones, friends, and be your neighbor's keeper. Thank you so much. God bless everyone. And our greetings to all God's heritage in your care. Let's have a blessed evening.